Good evening, everyone. I'm Mayor Weinberger. Thank you for joining the Telephone Town meeting event this is the third time during the pandemic that we've tried to gather the community and talk about key milestones in this pandemic. We had one of these way back in March, just as this was all beginning. We met again in this format when we were starting the reopening, and we're now approaching another key milestone in this pandemic, the reopening of our public schools, which have been closed since March. And we thought this was a good time to come together. We have people joining by phone, by Zoom, and on Facebook Live tonight. And I am really thrilled to have here with me two guests from the UVM Medical Center, Dr. William Raszka, and our brand new superintendent, Tom Flanagan, who has joined us in the middle of this pandemic and taken over the Burlington School District. And what a time to have begun your tenure here, Tom. Thank you for your service at this real time of need for the community. I'll kick things off with just a couple remarks here, and then hand this over to Dr. Raszka and then Superintendent Flanagan, each of whom have slide decks who they will share and walk through, and then after that we are trying to reserve some time for your questions. I was a big supporter of shutting down the schools early last March. I thought it was a critical step as the virus was descending upon us, and we had so little testing information, and so little understanding of the virus. I thought it was something we had to do, and I think the fact that Governor Scott made that decision with superintendents was critical and part of the success of keeping the levels of virus here in Vermont always at a pretty low level. By the same token, I think we have to acknowledge shutting down the schools has massive impacts on the community, large impacts on kids that during critical times of their lives you don't get back. Remote learning, we're all, as a parent of two children in the school district, very appreciative for the incredible hard work of teachers to keep our children learning remotely, but it's not the same. We all know it's not the same. There are also broad impacts on the rest of the community. We all know that there's major economic impacts, disruptions when the schools are closed. So as much as I thought we had to close schools when we did last March, I now, have long throughout this summer really thought it was critical that we do everything we can to make it possible to reopen our public schools this fall, and it is exciting to me that we are less than a week from when children will return to classes. And I say it's exciting because I think we've got the ingredients here in Burlington to make this successful. What do we know about the possibility of reopening schools? Well, first of all, we know other parts of the world have done this successfully. There are other parts of the world who are ahead of us and have seen school districts reopened since the pandemic began and been able to operate safely. Second, my sense, and we'll hear more from Dr. Raszka in just a minute, it is my sense that we have met the public health conditions necessary to attempt to do this. One, we have very low levels of virus transmission in Burlington, in Chittenden County, even in the whole state. And it's been that way for an extended period of time, which sets us apart from most of the country right now. So I think it can be the case that it's the right decision for LA and many other school districts to have decided not to reopen, but also be the right decision for us to be attempting to do so. But the other thing is you can't just have schools operating as normal. You have to take steps to keep those facilities safe. These are not normal times, and I think part of what we're going to hear about tonight is what the school district has done to prepare for to operate in the moment we're in. So with that, if you're listening by phone and you want to make a question, it's going to be a little while before we get to the questions, but I'll just say now, you press *3 if you want to ask a question, and we have some people standing by here to help us pull this off and get your question asked. And if you're on Facebook, go ahead and use the comments function, and we're going to try to monitor that and answer as many of those questions as we can over the course of the next hour. So with that, thank you again, Dr. Raszka. Thank you, Superintendent Flanagan, for for joining tonight. And Dr. Raszka, turn it over to you. Thank you for all your service. I know this school is issue something you've been working hard on for a long time.
Indeed. Thank you very much for inviting me to join this. I'm very excited to be here. So, as the mayor said, I'm a physician, I'm a pediatric infectious disease physician at the University of Vermont Larner College of Medicine. I'm also a teacher at the Larner College of Medicine. And I do have to let everyone know that the opinions I'm going to state are my own and not necessarily those of the University of Vermont. But I want to talk about 4 different things, and I think the mayor alluded to some of these things. One of them is COVID-19 the same as it is in Vermont? Are our prevalence rates different in Vermont from other parts of the country? We're going to spend a little bit of time about the transmission of SARS-CoV-2, the virus that causes COVID in children, and how does that influence our thinking about opening schools. And then we're going to review some of the school reopening data that occurred last spring and early summer in different parts of the world, and also even in the fall in different parts of the world. And again, spend a bit of time thinking about the strategies to minimize the risk of transmission in schools. So for those of you who are on Zoom, you can see this map of the United States. It's a heat map of COVID-19 infections in the United States. And you can see there's some grisly purple areas in the Sun Belt. That shows there's a lot of transmission. There's a lot of COVID there. If you look up in Vermont, and again, it's for the phone, you can't see it, but there's very little disease there. This is an absolutely fundamental concept, and the mayor alluded to this. COVID-19 is not uniformly distributed across the United States. Our prevalence rates are really, really low. Everyone is barraged every day, but the numbers across the United States, rising rates here and there, astronomical surges here and there, particularly in the Sun Belt. That is not Vermont. We have a very low prevalence. If there's any take-home message from anything I say, I want everyone who's listening to that, to this discussion tonight, to remember that the prevalence rate in Vermont is much lower than almost anywhere else in the United States. And our comparison group is Maine and countries in Northern Western Europe. That's our comparison group, not Georgia, not Texas, not Mississippi, not even parts of Iowa right now. Vermonters have worked hard. There's been economic pain. There's been this great messaging. We are in this great situation because of all the efforts that people put into this, but our prevalence rate is really low, and that's a great place to be. So what's the data on SARS-CoV transmission in children? It turns out that initially these were based upon household contact studies. They would find children who were infected with the virus or had COVID-19 and say, well, you know, what happened? Did they get it from an adult? Are they transmitted to somebody else? And basically all the household contact studies that have been done have really suggested that children are not the drivers. But almost always the children had acquired the disease from an adult, whether some household or someplace else. There was a really well-publicized study out of South Korea that was published in July of this summer that suggested that children 10 to 19 were just as infectious as adults. Got a lot of national play. It turned out they looked at their data again 3 weeks later and said, now that we actually can figure out which way the transmission is going, it turned out that children were remarkably unlikely to transmit the disease in their household, that they primarily had gotten it from other contexts. So household context studies are really reassuring. School-based studies at the onset of the pandemic are also really reassuring that young children, particularly young children, were not transmitting the disease to other children or adults. And that's based upon data in Singapore, Ireland, Australia, and other countries in Western Europe. Just they were not transmitted. It was actually hard to find many children that had transmitted to other children or adults. Little note of caution, we had to be a little bit more cautious in teens. One French study suggested teenagers were acquiring the infection at similar rates or close to similar rates as adults. So our general thought, and something that Dr. Lee and I have said for a long time, is that children, particularly younger children, elementary school age children, are less efficient at transmitting the virus that causes COVID-19. How about the school reopening data? There's actually some really reassuring data here. The child care data is remarkable. So in the beginning of the pandemic, child care centers were taking care of children of all ages of essential healthcare workers. So this is not just 3-year-olds and 2-year-olds. These are 2-year-olds, 5-year-olds, 12-year-olds. And the YMC data is amazing. There were occasional people that were identified, and settings who had COVID-19, but there were no outbreaks. There was no ongoing transmission. A report just out of Brown and Rhode Island data suggested, again, with some simple mitigation procedures, they were not seeing outbreaks. Our Vermont data over the summer is incredibly reassuring. Our Burlington data over the summer, really reassuring. We're not seeing outbreaks. Really good news. In areas of low prevalence, the data is really clear. There's been little transmission in schools. Now I have to be very careful. In areas of low prevalence, so this is Denmark, this is the Netherlands, this is parts of Germany. And really importantly, 3 Scandinavian countries actually measured incidence rates or prevalence rates of COVID-19 in teachers in the general adult population, and they did not see a difference. And they were not seeing a change in prevalence rates. This is really great news. But again, low prevalence areas, in areas where there is high prevalence, when you open school, things don't go well. So in Israel, when they opened the entire economy, opened bars and schools at the same time, and could not physically distance in Israeli high schools, they saw lots of disease in the high schools. So our conclusions are that in areas of low prevalence and with wise use of mitigation procedures, the data is really reassuring about school opening. So what's our approach to minimizing the risk of developing COVID in schools? It's really a 4-pronged attack. One is to keep the prevalence rate in the community low. This messaging about masking is essential. Physical distancing, avoiding congregation indoors, really important. We want to make sure that if you're ill, that you don't enter school. This is going to put pressure on families that sometimes children will go to school with a runny nose or something, but we have to make sure that nobody ill enters the school system. Many of us have worked a long time to develop a pathway for the school nurses, the home care providers to develop ways to make sure we know who needs to get tested and when they can return to school. Inside the school, we have to minimize transmission, so masking is going to be important. So again, all children are going to be required to wear a mask unless there's a developmental or medical reason not to wear that. The teachers will be wearing masking. We're going to use physical distancing. There's a controversy about whether that should be 3 feet or 6 feet. Different organizations have different recommendations. Keep in mind the 6-foot rule that the CDC follows is based upon adults coughing. 7-year-old children cannot cough the same way a 60-year-old man can cough. They're really different. So that's why some people are using 3 feet or 3 to 6 feet. We're going to avoid congregating in indoor facilities like gymnasiums or cafeterias. Some schools, though not necessarily Burlington, will use staggered start and end times. Hand washing will be important, and daily cleaning. The deep clean so we don't need to deep clean every couple of days, but the facilities, the staff there have a great plan of routine cleaning. And of course, we're going to identify those people who might be infected and isolate, and we have a great contact method to do that. So what's my summary? We have a low prevalence rate in Vermont, which is fantastic news, and the mayor emphasized that. This is a great place to be. We are different from every other spot. We've had consistent messaging from the governor and the health department and everyone else about distancing and masking. That's going to be essential to maintain. The schools have developed marvelous mitigation plans. They are really on top of it. They've been working on this nonstop for a long time. And the health department is ready to step in, and they've done a marvelous job. So we are in a great position to open schools. I'm excited to be part of that process.
Well, thank you, Dr. Raszka. That was excellent, and really thank you for just pulling together that comprehensive sense of the numerous different sources we can look to have confidence that what we're attempting to do here makes sense and is achievable. I think and I appreciate the core point, which, as I've understood, is the key to reopenings of schools and pretty much every other element of our society that we have been reopening since May in earnest, is to have these public health procedures in place. And I know that this is something the Burlington School District team has been working hard on. Something that I've really appreciated that has gone on throughout the pandemic is that the school district and the city have been in close touch in a way that during normal times, we do some of, but nothing like we have since the pandemic. We have, at one point we were meeting together basically almost every day. Then we went down to 3 times a week. Now we're down to about a weekly coordination call between all the city department heads, as well as a representative from the school district. and UVM Medical Center too. It's, so I know there's been a lot going on here. I'll hand it over to you, Superintendent Flanagan. Thank you again for joining us and for sharing some remarks.
Absolutely. Thank you for having me. Let's share my screen really quick here. So I just wanted to, thank you, Mayor. Thank you, Dr. Raszka, for having us here today and for setting this up. I think it's really important. We've been using a set of core principles in our planning to return to school, and those principles are equity, engagement, and deep learning. And this is an opportunity for us, I think, to engage with our community, and to hear questions and to be able to give some information. I was really fortunate last week to be able to have the opportunity to meet with many of our families of our multilingual learners in a tent behind Flynn Elementary School and to answer many questions there. And so I'm just really thankful and grateful for the opportunity to be able to have these opportunities of engagement. Also excited to be here. As you said, Mayor, I am new to Burlington. And most excited to have my three daughters, who are going to be one in middle school, two in elementary school, head back to school on September 8th, and they're really excited to get going. So we want to really emphasize the importance of collaboration. Mayor, you mentioned it. Dr. Raszka, we've been on calls together, and so it's just great to be able to have the opportunity with UVM and with the city to collaborate. Also, we've been collaborating really closely with our union leadership and our partners in the unions to make sure that we have an open and honest and trusting relationship, and so that we can work through the things that we need to work through, because school is going to look different than it did when we left in the spring. We are currently finalizing details. There's been a task force in Burlington Burlington Schools that has been working since April, really planning this out using a project planning management process with 16 task force members and 12 work groups off of that task force, representing many people within our school department and across the sort of levels of our school department, so that we're making sure we're getting all the input that we can possibly get to make sure that the decisions that we're making are the most informed that they can be. Moving forward, we're really going to want to continue to collaborate and communicate. And I also want people to know that I am open to feedback and ideas for improvement, and my team is as well. Our models, many of you know about these, so I won't take a lot of time going through them, but we are offering a hybrid model and a remote model. And in that hybrid model, it's an A day or a B day. And so students would go to school either on Monday and Thursday or Tuesday and Friday, with every Wednesday being a remote day for students. Learning is going to be happening on A days and on B days, whether you're in school or at home. And we're really emphasizing the importance of being back to school to make sure that we're catching back up for any learning that was lost, and then continuing to move forward with this priority of deep learning and of really engaging meaningful learning experiences, which is, to me, the core equity imperative that we have in our district. Along those lines, we are offering 4 days of learning, of in-person instruction for students who have IEPs as a result of a special education need, and also English learners. We wanted to make sure we were prioritizing services for those students. And we are also still keeping class sizes small and ensuring that there is distancing. Class sizes are ranging between 8 to 15 students, with, I think, the average class sizes are probably in the 12 student range. And if you walk into our classrooms right now, I've been walking the schools, and you'll see class desks that are spaced apart, but still bright, welcoming, engaging spaces that show that we are ready for students to come back. I was over at Sustainability Academy today and Flynn yesterday, and the halls are gleaming, the walls are gleaming, the classrooms are set up, and we're ready for learning and excited for students to come back. We also have, and 90% of our students chose the hybrid model. And so I think that just shows the will of the community to return to school in person. About 10% of our families chose the remote option, which is a great option as well. And we have a group of teachers who are going to be teaching those full remote options, and they're going to be reaching out this week, today, tomorrow, and Friday, to make sure that they're connecting with families. We're also making sure we're continuing with the focus on social emotional learning and restorative practices, because we've been through a time of trauma as a community, as a nation, as a global community, and we are committed to restorative practices as a way to heal together and to restore relationships. Obviously, health and safety is our #1 priority. And so we are really prioritizing making sure that we have health and safety precautions in place. Those are, Dr. Raszka mentioned them earlier: masking, health screenings as students are coming into the building, washing hands, and making sure that we are adhering to cleaning and those types of guidelines to make sure that we're keeping those spaces clean. Also making sure that we've been reviewing all of our ventilation systems. So over the course of the summer, we have done an analysis of all of our HVAC systems to make sure that, and we've replaced filters at all of those. We've upgraded filters, and we are increasing airflow. So I was actually in a room today where usually you can't feel the airflow. There's an in and an out in each room in terms of air coming in and coming out. You could actually feel the air moving. And so we've been able to increase airflow to keep that going. Also, we have some rooms where we've purchased air purifiers, and so where there are air purifiers in some spaces, we don't need them in all spaces, but in some spaces, and also fans in some spaces, and also emphasizing, we are also emphasizing outdoor learning. We have tents at each of our schools, and multiple tents at some schools, and making sure we're providing an opportunity for students to get outside too, for outdoor learning. Also, to be able to get outside, to have a break from the mask. We know masking is something that you build kind of some resilience around, and so we're going to make sure that we're doing that. I think one thing that I've been messaging that's really important for people to know is we did run summer programming this summer at 5 of our sites, smaller groups of students, but we did get a chance to practice this, and we had a really successful summer program, and I think we learned a lot about what school can look like, and that has informed our planning. Facilities, I mentioned a second ago. So, but when you do look at a classroom, for the most part in our classrooms, you're going to see desks spaced 3 to 6 feet apart. The guidance from the Agency of Education changed last week, or a couple of weeks ago, from the recommendation of a 6-foot physical distancing to 3 to 6 feet. Because the numbers are so good in Vermont, and we're in a good place, we were able to flex that a little bit. That allowed us to bring students with IEPs and students who are learning English back, and also allowed us to look a little bit more flexibly at our classroom setups. We do have barriers in some. I was in a room today there was a circle table, and there's plexiglass in between so that students can actually sit across from each other around a circular table, but there's a plexiglass in between, but it doesn't feel overly sterile. Again, it's warm and welcoming, and the classrooms I think look really, really great. The food services, we love our food. We've got great food here, and we're going to make sure we're serving great food, lunch and breakfast free of charge, and making sure we're getting meals out to students on those off days. And obviously, with everything we're doing, following CDC guidelines, and every plan that we've made is based on the guidance from the Agency of Education, which comes from the guidance of the Department of Health, because those two are working in very close communication. Transportation is something that we're really working hard on right now. I mean, the Green Mountain Transit has reduced the number of riders on buses to 18 and so we've been working with them and with our city partners to think about transportation. There's some movement there, but I've also been messaging to families and to students and to our community as much as we can. If we can utilize other forms of transportation, that will help to sort of ease the demand on the public transportation, and also not not all of our students will be in school every day, so that'll give us another a little bit more opportunity to practice what this will look like. We're hoping that, we have a lot of success and that we can come back to school safe. I believe strongly, and I'm confident that we can come back to school safely. I'm also hopeful that we have success and that we can come back to school, particularly in that pre-K-5 range, as soon as we possibly can. Maybe even if we have a lot of success in September, coming back in early October so that we can get back to school 5 days a week. I know the alternating day schedule is a real burden on our families and our community. And so we want to make sure we can get back as soon as we can. Just some dates at the end to remember. School starts on September 5th for the majority of students. Pre-K starts on September 14th. We just learned that the Vermont Virtual Learning Collaborative, we learned yesterday, that's the way that our students in grades 9 through 12 are going to be receiving their remote learning. For those students who are fully remote, is going to start on September 14th. We're getting started with sports. They're going to look different, but we want to make sure students are out and active and enjoying the community that sports brings. And yeah, so we're ready to go. We're excited for school to start on September 8th. That's that, Mayor.
Well, that's great, Superintendent. That's thank you for walking us through all of that. Let's try to have a conversation now. And I do see questions starting to come in on the chat here on Zoom, as well as on Facebook. If you would like to talk by phone, again, press *3, and we'll try to get you on the air. I have one question as we're starting here. Dr. Raszka, how, we've been at the city talking a lot since May and attempting to reopen. We have really had this been using this concept of boxing in the virus, and basically the concept being we are going to have positives from time to time within the community, and we have some days where there's zero evident, no new infections that we're aware of, but generally it's the average for months now has been around 4 or 5 in the county, sometimes less, sometimes a little more. And what's really important when there is an infection, it's not, for the great majority of people, this is not this is something that they will recover from. And the goal cannot be, the goal is not right now, the public health goal is not 0 newer infections, but the goal is that when there is an infection, that we're able to box it in quickly. We're able to, through testing, contact tracing, isolation, and quarantine efforts, we're able to quickly define who has the virus and keep them separated from others so the virus doesn't spread, and keep them separated from really vulnerable communities. Is that the way you're thinking about the school effort as well? I mean, is it realistic to think that we will have 0 infections, or what should our expectations be as we think about the possibility of infections in schools?
So thank you for that question. I think that the likelihood of infections in school is low, but it's going to mirror the prevalence rate in the community. That if we keep the prevalence rate in the community, we're going to have a low prevalence rate in schools. And actually schools may be even a bit safer than most other public spaces, because we're going to be screening people to go in. We're going to be monitoring very carefully. We're going to do contact isolation. I think it'll actually be a very safe public space. But there will be some child that will be diagnosed with COVID-19. And the state health department has really elaborate plans, just as you mentioned, that as soon as we identify a person, we're going to do contact tracing. That one of the reasons that we're really interested in making sure we know exactly who those children are with is so that we know who are the potential exposures. There's a very specific definition for an exposure. The health department will be notifying everyone really quickly. We can take action. We can do isolation, contact tracing, and minimize the transmission. So I agree, we're going to try to minimize the risk. We cannot reduce the risk to 0, but we actually have a really nice strategy to make sure that it doesn't blossom from an individual case.
Great. I think we will go to the telephone for a question.
We're going to take a question from Kiernan. Kiernan, you should be able to ask your question now.
Oh, hi. Yes, it's Kieran Turner. And yesterday, Secretary French in the governor's press conference indicated that schools would likely be going to step 3 right away, like in 2 weeks. And so I wondered how Burlington schools were going to handle the physical distancing in that scenario with all kids back at school. Thanks.
Great, thank you. And maybe Superintendent, as you're answering that, can you just make sure everyone listening understands what level 3 means?
Sure. So there are 3 steps in the Vermont Department, our Agency of Education guidance for returning to school. Step 1 is fully remote. Step 2 is kind of this hybrid remote option, and or it includes language that led us to the decision to do hybrid remote to start. And then step 3 loosens some of those restrictions. So the important thing to know is that moving to step 3 doesn't mean that we are directed or given the green light to immediately go into full on in-person instruction. What it means is that some of the restrictions, some of the guidance loosens a little bit around physical distancing, and some of the guidance just allows a little bit bigger groups to be together and to have some more flexibility. So it indicates that we are more ready to come back fully in person, but it's not a signal that we have to come back fully in person.
Okay, great. I think that sort of speaks to, and I know you touched on your presentation, but I think it's it's something that I know is a big issue in my household. Is what we've got a lot of precautions in place. We're being very careful about this. If things go well and there is the opportunity to expand in-person learning, is that something that is explicitly a goal of yours and the district, is to go to more than 2 days a week as soon as we can?
Yes, absolutely. I mean, our goal is to, I think the community has been clear that they want to be back in person, and it's pretty clear that people want to come back more than 2 days a week, because that just places such a burden on families. But also we know that students, need 5 days a week of learning that is in person as much as we possibly can. So my goal is to be back as soon as we can. I'm hoping early October, and there's a lot to work out, a lot of details to work out to make sure that we can do that. And so I think this was why it was the right decision to start this way, because we have to rethink the entire way that we operate, and there are contracts in place, and there are a lot of things that we have to work through to make sure that we're able to operate under different conditions. Because even step 3 the conditions are not the same. It's not like everything is lifted and you're back to school as you were in last January. There are a lot of pieces to work out there. My goal is to get back in early October, and I'm really hoping that we show success here. We work collaboratively to make this happen, and we're flexible, and we make it happen, and show that we can come back, because that's the right thing, I think, for kids and for the community.
That's a really helpful point and it's really, if you think about it, that's kind of marked the whole Governor Scott's the way the whole reopening has been approached. It has been this incremental quarter turn, eighth turn, sometimes he says, of the spigot, doing that with this major function of the school district as well, doing it in this incremental way. Makes a lot of sense, and it's great to hear that there is a possibility out there that we could get back to more normal times and more normal schedule with in-person learning not that far down the road. I see some great questions coming in on the Zoom. Let me try to get to a bunch of them. They're sort of straightforward, but this is, I think an indication, as a parent out there, we get so many communications, getting some of this basic stuff right is really important. So if there's someone, Laura is asking, if my child goes to school on A days, since we're closed next Monday, does that mean the first day of school will be Thursday, September 10th for kids on A days?
Yes, the first in-person day obviously will be, or maybe not obviously, the first in-person day will be on the 10th. But we will be reaching out. So teachers and schools will be reaching out to their classes before school starts. And Wednesday is a full remote day. So that would be a day of where there can be where there can be a check-in. The issue is that not all, we are distributing computers or iPads for grades pre-K through 2 and 3 to 5 Chromebooks. So students won't have that yet. So I think, yeah, officially, the first real day of learning and a full learning and engagement will be the 10th for those families that are 8 days.
Great. Okay, that's really helpful. And sort of along those lines too, I see a question that, again, I know it's just a huge question in everyone's mind. What will school look like on virtual days? Is it going to be like the spring, or are there some real changes from the spring that parents should be expecting and kids should be expecting?
So I think the model itself creates real changes, because one of the things that we really cared about was that there would be continuity, as much continuity and sort of connectedness throughout the week as there could be. And we felt like having 2 days that weren't side by side allowed that to happen, so the students weren't away for too long. So a lot those remote days, the B day, right, or the A day, if you're depending on which group you are, those are going to be students are going to come home with work that was prepped the day before, and then we are also working on figuring out ways to connect to students to each other, students to teachers on those days, and making sure that they are connected in to their learning and to their class on those off days. And there are different ways, because of staffing and because of kind of what is possible based on what different schools look like. Those days will look a little bit different for different classes and schools, but we're also working to create as much consistency as possible. That Wednesday, which is the remote day for everyone, will be a remote day. So we have put out schedules of sample schedules of what those days look like, and schools are putting out individual schedules of what those days look like. So the remote day, that Wednesday, will include more touch time, because you'll have all students at home and the teachers will have time to work with students on Wednesday.
All right, great. Dr. Raszka, I think here's a great question for you from Adam. What is the plan, is the question, for regular COVID testing for students, staff, and teachers to identify and mitigate any outbreaks, and to agree that I think, we're not relying on that kind of surveillance testing. I think it would be great if you could explain to people, it's sort of part and parcel of your broader explanation for why we should still be reassured, but can you speak to the testing and our strategies around testing?
Sure. So right now, the Vermont Department of Health and our UVM Medical Center do not support routine testing of asymptomatic individuals, and particularly using antigen tests. There's been a lot of interest in doing testing, surveillance testing. Dr. Jha has promulgated a thought that we could do lots of testing all the time and we could identify people. The problem is that we don't have a really inexpensive point of care test that's sensitive and highly specific. It doesn't exist. When that does exist, then that would be a really great idea. That would be really cool, that we could actually do a lot of testing. Every single student would be tested a couple times a week, every single staff member. We just don't have it yet. The Abbott test, the Binax Now test that got all the publicity, is still only approved for testing people who are asymptomatic and in the first 7 days. And here's the speed of science and decision-making these days. That test was approved based upon 102 results. It takes a couple thousand test results to get a new strep throat test approved, but this is approved based on 102. We don't really know how that's going to perform in a surveillance model, to be honest with you. The Vermont Department of Health and the governor's scientific task force will be taking up this issue again. We looked at it this past week. We're going to look at it again this week. But right now, that testing is not ready for prime time. It's on the radar. Once we have a better testing kit that can be used in this situation, then we will have to thoughtfully think about how to roll that out across the state.
Great, thank you for that. And one, let me add to the conversation one of really a long list of things the city city government as opposed to the school district, the municipal government is trying to do to, recognizing how critical it is that this reopening succeed. We have been, and there was a 7-day story on it earlier yesterday, and we talked about it a little bit on my briefing yesterday. This is sort of real time, it's evolving, but something we have been working hard on through the month of August is some kind of wastewater testing that would potentially, if this works, give us a early warning, an early sense of virus levels, virus transmission levels changing in the community. We potentially could narrow that down. One thing that is being looked at specifically is whether you could actually do wastewater testing, so actually testing the wastewater flows in a way that would give us some sense of whether there was new positives happening at the high school. We, like Dr. Raszka's points about how science is evolving and this is a very fluid situation, you always got to look out for those bad puns with wastewater. We don't have this totally nailed down, but something we're working hard on, and we're hopeful about this giving us some additional level of monitoring in some sense of virus transmission levels in the community and some early warning sign if there is starting to be a problem in a certain area. Let's go back. Do we have anyone else on the phones, Jordan? Okay, we don't have anyone on the phones, although we do have, let me just say again, we know there are hundreds of people who are listening on the phone, so if you are, *3 is the way to get your question in if you are on the phone line. Let me go to another question on the Zoom. Let me see, this is a long one. Let me see if I got the detailed one. It's a question for Dr. Raszka. When a child is discovered to have a fever or other COVID-like symptoms during the school day and they are placed in the school's isolation room while they await for an adult to come pick them up, will the school nurse and staff member tending to them have PPE? Like how, maybe you could just, it's a pretty detailed question, but could you speak to that? I mean, that is something that probably their parents will want to know about if there is symptoms like that, what's going to happen?
Sure. So if a child is in school and then develops signs and symptoms that could be consistent with COVID-19 infection, the child will be removed from the classroom environment. There are pathways to isolate that child in a space that has adequate ventilation, that has adequate distancing, and the people caring for that child will have adequate personal protective equipment. So everyone in the school system is going to be masked. The teachers will probably be wearing higher levels, either surgical masks or procedure masks or KN95 masks. These are just different numbers to say how much they protect people from becoming infected or spreading the virus. But very specifically, the school nurse or that healthcare personnel will be wearing medical grade masking as well as eye protection. There should be very few circumstances where a school nurse will need a medical grade N95 mask, which is what we actually use when we are taking care of COVID infected patients, but we are recommending that they have a supply of that should the situation require it.
Great. Here's a question, it goes back to, this echoes with questions I've heard throughout the pandemic from all sorts of operations wanting some sense of notice if there will be kind of changes in posture. The question, Superintendent, is, you referenced the possibility of maybe even in October, a month out, going to some kind of new footing, a change in the schedule. Do you have a timeline that you can speak to about when how much heads up you'll be able to give people? Like what kind of, if we are going to make a change, do you expect to be able to say a week or two ahead of time that change is coming, or is it going to be more sudden than that?
No, my plan is to make sure that we're giving people at least, I don't want to put a specific day on it, but we want to give people time to come back. And I think that one of the things that we're really trying to do is work closely with our families, and that really happens at the school level, but making sure we're not putting policies in place that prevent families from making decisions that are best for them in a time that is extremely challenging. So my goal would be to give at least give 2 weeks notice, and I think, but also balancing wanting to get back as soon as possible. So to me, that's the tension, and so I believe we're gonna. Dr. Raszka has much more information on this than I do, but I really think we're gonna know a lot more when we get into the second and third week of September, where how we're doing. We'll definitely know how we're doing, right, in terms of how we're operating, and then I'm really looking carefully at the numbers across the state, so and in the city. So if the numbers continue to look good in the city, we're operating well in mid-September, and we feel like we can make the shift to operate, then we would do that. So want to give as much time as possible, but also want to get back as soon as possible.
Great. Here's a great question. I think goes straight, Dr. Raszka, to your point that a lot of our confidence in this plan is based on the general level of low prevalence in the community. What in the school planning, is there a sense of how much things would need to worsen before we would say we're no longer in a low prevalence situation and this has broader implications? Are there any rules of thumb or kind of standards, or just what's your reaction to that question, the possibility of that general condition changing?
So I think that the health department and the Secretary French and the governor, everyone's going to be monitoring the infectivity rate. Everyone's going to be watching that. They're going to look at the rolling averages. They're going to look what's happening over time. Is our infectivity rate creeping up? We're like 0.25% right now for our cumulative average. It's just so low. Other states have set a 5% threshold. That's a huge margin for us. But this rolling average will be careful. And I think we're going to have to be thoughtful about, like, if there is, say, an outbreak in Manchester, it's unclear to me that you would need to close anything in St. Johnsbury. Actually, I would hope you wouldn't have to do that. I think we're going to look at a statewide level, and then we can think about how can we apply the data into local areas, because I want Superintendent Flanagan to have as much flexibility as he can as well.
Yeah, and I would just add what we've learned from what we've heard from Secretary French, and Dr. Raszka speaking to this, is that that's going to be a decision that we will be a part of at the local level, but we also are going to be in close coordination with the Department of Health and the Agency of Education on any decision around going back to COVID-19.
So I'm going to share my screen for a second here to share a resource with people that I'm not sure, I want to make sure people are aware of. If you're trying to monitor yourself, what's going on, that general prevalence, how are things going, one resource we've created here at the city is we've created a dashboard on the city webpage, and this is one image from that dashboard where you can see these are the new cases, new infections in Chittenden County by day. Each bar there is a day. And you can see actually today was a very good day. There were 0 new cases that were reported out today. There was another question I saw in the chat suggesting that we are creeping back up to levels such as where we were in the spring. I really don't see it that way. I mean, if you look at that black line there, it's a 7-day average of the average number of new cases per day, and you can see for really since the outbreak in the old North End and Winooski in the early June, which is that spike in early June, we've had you have a little bit of jagged data day to day, but that average, that 7-day average has stayed right, pretty consistently about 5 or less, and that hasn't really changed. And then comparing it to March or in April is really very hard to do because we just had very little testing back in April. That first spike you see in April, those, back then we really had, we were largely blind to the rates in the community because we had so little testing early on. Another thing I want to point out, there's huge amounts of resources for people if you want to get into almost any element of the coronavirus response. I encourage people to check out the city's webpage. I'm trying to find one. Just sort of one more thing that goes to a message that is sort of a visual way to think of some of what Dr. Raszka was mentioning before, and this goes to all of our responsibilities as we're trying to keep that prevalence rate very low. This is a way to think about what you can do in a kind of graphic way. Where are the highest risks? Where are the areas that you're most at risk for contracting the virus? We talk about the 3 C's: closed spaces, indoor spaces, crowded places where there are many other people, and close contact setting situations where you are within 6 feet of other people for an extended period of time. What I like about this graphic is it shows, and we kind of stole this from Japan. They were the first one where we saw a graphic like this. Areas where those settings overlap are even higher risk, and then where you have all 3 of those conditions, that's where you really have the conditions for a super spreader event that we've read so much about, and where you can have large numbers of people infected. So I found that a helpful device to think about as we're all doing risk assessments as we go through our daily life and think about how we navigate these times. All right, I think we'll go back. I believe we have another question on the phone line.
Yes, we have a question from Barbara. Barbara, I'm going to enable your microphone so you can ask your question live.
Hello, can you hear me?
Hi, Barbara. Welcome, Barbara.
Hi, Mr. Mayor. My question was a concern about high school students, particularly junior high, but particularly high school students. I noticed when they're not in school, and I had an incident just the other day where they're out in big groups, not distancing, not masking, and when I spoke to them, they weren't taking it seriously at all. Is there any education program for them while they are in school about the seriousness of the virus and how they need to behave when they're not in school?
Yeah, I think that's a great
question, Barbara. Thank you.
Yeah, and I appreciate that. I actually think being back in school provides us the opportunity to do that in a way that we haven't been able to over the summer and spring. So I appreciate you bringing that forward. We are going to be talking about, particularly in high school, the COVID and how to be safe, and we will have lots of signage and conversations around that at the school, and we will also make sure we're including education about how to remain safe outside of school. I think that's a really important point that we can definitely emphasize as we head into the school year.
Can I add one thing? I just think it's all of our responsibility that in every single situation, we should remind people that we're in this together. I actually saw a patient today, delightful teen, and he said he would never wear a mask when he visited his friends at their house. And because I don't wear my shoes in their house, why would I wear the mask? And I wanted to emphasize to him that's a sign of respect for that family, that you're going to wear a mask so that you wouldn't transmit the disease. That I hope that we can, in all our situations, whether we're in the medical or in the school or out in the soccer field, or they also say, this is a sign of respect. This is a sign that we are going to help prevent disease. But everyone has to have that same message.
Agreed, thank you.
Here's a really interesting question that I think this would be great if we can sort of set some expectations for people. I can imagine it'll be a scary moment if and when there is a positive in a Burlington school this fall. What should people's expectations be about how, and I know it's impossible to speak to kind of every permutation here, but maybe you could speak to kind of the philosophy, a little more to the philosophy that we will employ. Does one positive mean everybody's getting sent home for a while until we figure it out? Or is it is there going to be kind of are you going to work with these pod systems you set up? How, can you speak to how, what should the expectation of parents be if there is a positive?
Yeah, and Dr. Raszka, you can add on if I need help here, but we're going to take every kind of illness seriously, right? I mean, I think the big thing to know is that we can't come to work or to school when we're sick in a way that we may have done in the past. So if a student gets sick, we are going to make sure that we isolate the student. We have spaces. Dr. Raszka talked about that. We also, our COVID coordinator for the district is one of our school nurses and our lead nurse over at Edmonds Middle School. So she's helped us get the rooms prepared and the guidance around what those rooms look like and what the supplies are that we need in those spaces. And then if a student though is positive in one of our schools, we would use contact tracing, right? So we would immediately work with the Department of Health, who would take the lead with us and collaborate on how we followed up with families. And we would be looking at those students who spent more than 15 minutes with that, look at the people who spent more than 15 minutes together within 6 feet first. And that's who we're hearing the Department of Health would be reaching out to for contact tracing. We would want to make sure that we're not premature in providing information about students who are sick, but that we also will be providing information if a student is positive or if a person is positive in a school building. And we do have language around that in a letter that we will be sending out if that were to happen, but hopefully that's not the case, but it does happen. Did I miss anything, Dr. Raszka?
You were right on, Superintendent Flanagan.
All right, we're running short on time here. I think maybe the last questions, Lindsay has had her questions in for quite a while here. There are two of them. She asked, what about supporting children with disabilities and children on the fully remote option? And also, are there supports for parents who need to work from home? Could you guys help Lindsay out here?
Sure, yeah. Special education services are going to be provided to students who are both in the remote setting, full remote, and in the hybrid setting. And we have special educators who will be, and paraeducators who will be working alongside those teachers who are doing the remote, who are leading the remote learning. So our services will continue. I believe strongly in providing and continuing services and strong service delivery for our students with individualized education programs or students with special needs. So that will definitely continue in that remote setting. In terms of the support for families, if the question is for families when the student is in a remote setting, the support's really going to come from the teacher. So there will be a classroom teacher, a teacher at each grade level who will be in K-8, who will be leading the remote learning for students who are in full-time remote. So that support's going to come through those teachers.
All right, this has been great. Thank you to everyone who's participated on these various platforms. This is really I just had this sense that there's lots of questions out there, and we got a good sense of that tonight. We did not get to every question. My team will try to make sure that all of these questions are packaged up from the different platforms and sent over to Superintendent Flanagan and his team so that you can be mindful of these. And I know the school's doing a lot of communicating right now and in the days to come. So we'll try to hit anything that we didn't get to in that way. Before we sign off, thank you again to both of you. Do either of you have any kind of final thoughts that you want to leave our viewers with? We really have had, I think we've had about 500 people participating in this conversation in one way or another tonight. So thank you for helping. There's a lot of interest in this. Any final thoughts you'd like to leave people with?
So I would actually like to shout out to the state of Vermont. I have colleagues across the country, and we are in just such a unique environment. The health department, the schools, the governor, everyone is working together. It is a true collaborative effort. And because of that collaboration, we're in a great spot. I'm thrilled to be a part of it. Mask, socially distance, physically distance, we're gonna make this work. Thanks for allowing me to participate.
Awesome. Yeah. Thank you.
just to echo that, I agree. I moved here in July. I feel extremely fortunate to be living in Vermont with my family in Burlington in particular, and with the community's support and their welcoming of me. I'm just very appreciative. I do feel like we are ready to start school, and I know that there are still details that we are ironing out, but we've done a ton of planning, and we're going to be ready for and excited for students to come back. A couple events in the past couple of weeks that are happening at schools, and principals and teachers are just excited to see students and families coming back into the school. So we are ready, and I'm looking forward to it.
Well, Dr. Raszka, your colleague, the president and COO of the UVA Medical Center, Dr. Stephen Leffler, who's participated in our past town meetings and often comes on these briefings on Wednesdays that we have together, has really made a kind of point, the point you're making there, that one of the things setting apart Vermont's response is the coordination between different institutions and levels of government and agencies. I'll just close by saying that I am fully committed to that coordination and that kind of continued effort to work closely together, to collaborate together as we hopefully round the bend in this pandemic. I mean, I think we got a long ways to go with this still, but maybe we're halfway through this now, we can hope. Conversations like tonight really make me optimistic that we are figuring out how to deal with this here in Vermont, here in Burlington, and we are gonna together make our way through. We would not. I think it's important to point out fundamentally, while I think that coordination and collaboration on the part of institutions has been a key part of the success, none of that wouldn't have mattered if Burlingtonians and Vermonters were not so committed as individuals and as households to containing the virus and making our way through this together. The way in which everyone has chipped in with this has been a heartwarming element of this incredibly challenging time since the beginning. Thank you both for sharing your wisdom and giving us all a lot to think about as we start this important chapter, and a lot of tools to work with to make sure that collectively we make the reopening of the schools another Vermont win in the weeks ahead. It's been great doing this with you. We'll talk to you both again soon. Thank you everyone for joining us tonight. This video will continue to be posted on Facebook Live for those, if you have friends that missed it, if they want to go to the mayor's Facebook page, you'll be able to see it there. We continue to be available through our Resource and Recovery Center for any needs that Burlingtonians have during this pandemic. Send us an email at the Resource and Recovery Center, or give a call, and we'll do anything we can to help you and your household through these challenging times. Thank you all. We'll see you soon.
Thank you.
Yeah.